everyone. Good afternoon, everybody. I am Sanya from beautiful Spotless Skin team. I am sure all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like freckles like spots forming large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India, and according to study conducted across 4 Indian cities revealed that more than 80% of the population presents skin color heterogeneity on the face and irrespective of age and gender. This heterogeneity mainly results from hyperpigmentation spot and melasma. Indian skin tone more susceptible to pigmentary disorders. It occurs mainly in women, 90% and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Melasma and hyperpigmentation generally ignored as a sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hassles and to keep you informed, today we are here to know more about management of melasma from an expert. So let's connect today with our skin expert, Dr. Radha Subramaniyan. She is consultant dermatologist and cosmetologist based at Chennai and has experience of 10 years in this field. Dr. Radha Subramaniyan practices at Spada Skin and Aesthetics in T Nagar, Chennai, and her expertise lies in clinical and aesthetic dermatology. Welcome, Doctor.
Hi, thank you. Thank you so much for having me.
And Doctor, as we are going to discuss today about a very important topic, that is melasma. Before we start the questions, first we really need to understand that what is basically melasma if we define in a layman's language. So what is melasma?
Yes. So melasma is a broad topic but actually it involves only a short area in a face. Usually we call as a colloquial term as mask of pregnancy because of the hormonal changes that hugely happens in a female. It starts to occur really probably post pregnancy. So it's basically nothing other than a brown color patch, something like which you cannot feel even if you touch, something like a discoloration rather, which presents on both the cheeks, sometimes on the nose, sometimes above your eyebrows, on the upper lip area, and sometimes on the neck and the arms as well. Wherein, if you take 100 women, 100 people probably with men and women included, around 90% of the women would be having melasma. Okay, so the 10% is very least in men, whereas it is very, very common in a female. So the most biggest attribute to a triggering causative factor of melasma is attributed to sun exposure, mainly the UV index, the ultraviolet rays in the sun rays, is the one that is actually contributed to the increase in the deposits of these pigment underneath your skin. So with all these new molecules coming into the market and the use of media to understand its treatment and its follow-up, obviously we are doctors also struggling to cope up with the maintenance of these pigmentations. So one needs to understand what type of melasma each and every particular individual is having and treat it accordingly. So it differs, as I said, it differs in each and every individual that we are seeing in OP practice.
Right. So basically it differs from person to person.
That's right.
Okay. So how, doctor, one can identify melasma, that as you told that due to UV rays also it is called. So how can somebody identify that this particular thing which is happening is melasma?
So initially, very the early stages, they might see as a freckle. You told, right? The freckle like Usually we keep it as dots, and nowadays we've seen people taking mehendi and then keeping it as a beauty spot. It arises something similar to a beauty spot with small freckles like little brownish, very light brownish pigmented skin lesion. And as days progress, if it is not corrected or if it is not protected indeed, it spreads in size like a geographical map. So usually you see in the cheeks, sometimes on the nose bridge, above your eyebrows, above your upper lip, is the most common spot where the sun hits you on the face. Rather, it's very common here underneath your nose because the sun never, the UV never occurs here, or beneath your chin. Also, it never occurs because it is, since it's triggered by UV index. These are the areas where it hits the most. So it's the classical site where it actually hits. So in these area, because of certain changes that is happening underneath your skin on cellular levels, these kind of pigments are formed and it is coming outside to occur more. It is not only in a fairer skinned people, it is even more common in a darker skinned person also.
So is it not like that, it has skin differentiation? Somebody who is more exposed to sun can get melasma, and there may be various causes of melasma. So if we discuss about the causes, so what are the different causes of melasma?
So as I strictly said, it's proper strict sun exposure, rather a UV exposure, number one. Number two, hormone in a female. When we are talking about anything in a female, we attribute or blame it on the hormones, and we are putting on the hormones again here instead. And that's why the occurrence of a new patch after pregnancy is very, very classical. The name called the mask of pregnancy. And sometimes people who take over intake of oral contraceptive pills, again due to induction of hormones, the melasma again occurs again and again, or rather it spreads in the size more. And certain diseases that are associated with any thyroid or something that is autoimmunely affecting, like which affects your core of the nuclei of the body, that also has one of the features as melasma. So yeah, see, these are the various features when we are putting into a table, but the commonest one should be the first priority and should be addressed while the treatment options are also considered.
Definitely. Usually, doctor, what happened that people see it and they ignore it, or as you know that the media, the social media is so today people are using it that they see something on their face and they search it and they find something and self medicate. So self medicate is not the answer. What do you suggest?
Yes, there is. I can put it into two category. One is self medication, and another is DIY home medication, like home recipes or kitchen recipes. Which is most important thing that is considered probably more in the south, which we usually encounter is use of turmeric on the spot of melasma. It's a ritual that most of the South Indian women, rather the place which I'm put up in Tamil Nadu, we actually encounter more of the persons like using turmeric on as a ritual itself. And the certain ingredients in the turmeric also actually increases the vulnerability of the person's skin to sun exposure. Even though we attribute turmeric having an anti-inflammatory, a good, rather a great antiseptic property, it does irritate our skin and therefore posing more of UV exposure. And self-medication, yes. Like you go to the pharmacist, you ask for a treatment of any pigmentation, they give you a cream which will give you a great looking skin for the first few days. The glow is real, but it is actually not sustained, or it is not going to correct what you're having. Rather, because those cream will contain higher quantities of certain ingredients that you shouldn't be putting on the skin, so it will backfire. So you're going you won't know that probably you are not, you're getting on the bad side, worst side of what you're supposed to go, because the initial glow is actually real. You will have a brighter skin, and either you need to use it for a lifelong period, which will again make your skin even more thinner or get even more allergies in the future, or it will cause certain withdrawal effects where you need to stop that particular medication. If you will not be stopping, then it will start to throw in one or two or three of kuti bombs in your skin, like acne, eruptions, or something, darkening of this pigmentation, darkening of your skin tone, rather, something like that.
Right. And as you said, it can be a short-term medication for your skin, but not a long-term, because the root cause is still, hiding. If somebody is not going to a dermatologist, instead of treating it with home medication or self-medication. Um, Doctor, as we are discussing about melasma and hyperpigmentation, are there any difference between melasma and hyperpigmentation?
Yes, that's a huge topic indeed. Like, melasma is a part of hyperpigmentation. There are many conditions. Like, for example, if I have acne and I'm having a inflammatory pigmentation, dark spot following an acne, that's a hyperpigmentation. Whereas melasma is a typical specific skin condition that is arising from your skin out of certain causes. So that is different from the whole topic of hyperpigmentation. A person who's having a tendency to pigment for any other skin lesion in the skin should not necessarily develop melasma. Okay, so they will have the propensity. So you need to protect them properly, but it is not intermingled in either ways. This is a separate topic, that is a separate topic. Rather, melasma is a part of hyperpigmentation issues. But any person can get pigmentation out of anything. So only certain group of people will get melasma.
It is like that. Hyperpigmentation is a bigger thing, and melasma comes under hyperpigmentation. We can classify.
That's right.
Like
That's
that.
right.
Okay. And if we talk about hyperpigmentation or melasma, so are there any different signs or symptoms which are related to melasma and hyperpigmentation?
So usually, the skin is actually classified into whites, wheatish, darker. So it is classified because of the amount of certain substance, like called melanin, underneath your skin. So this much of melanin, a little amount of melanin, they are whites. A medium amount of melanin, they are peach. And a more amount of melanin, they are darker. So the amount of melanin producing capacity of that individual determines how much pigmentation they are going to get. One, if they get an acne, if they get a wound, the way it leaves your body, leaving a scar, is depending on your body's own capacity. For example, I pigment more, you pigment less. That's because how your body is made up of. So one thing that can trigger, that is one basic genetic level that actually maintains the pigmentation in each and every individual. But certain factors can even worsen that pigmentation. Like, I keep on meddling it, I keep on increasing its duration for healing. Then, if I'm not applying any sunscreen, I'm increasing the UV exposure to that particular healing process, then I might get an even more darker color than I'm expected to get out of a healing process.
Right. And sometimes is it like that? The youth. Usually, we talk about the youth. Are there any? Is it like that? The youth, because they are more exposed to UV rays, they go out for work and all. So is it like that? The youth have more. If you have seen in your clinic as well, that the youth or the girls of young age are coming to you, that melasma pigmentation is, or is it like that? It can happen at any age.
Melasma, as I said, like, it's more on the like 30s. like late 25s, late 30s, somewhere like that it appears. Probably they might have few spots like a freckling starting around 25 to 30, but the youths mostly come to us with pigmentation. Not because of the healing process, because of their tendency, yes. And one more thing is because some people would have excoriated it, like couldn't have stopped them from picking your skin. Probably experience teaches them a bit, like if they keep on meddling with an acne or anything that would pigment, they would stay away. That would teach them like experience wise. Otherwise, usually the melasma is in the little later 20s, later 30s, early 30s, somewhere like that, if it has to occur. But youth usually suffer because of the hyperpigmentation as such.
So is it like later 25 of age, 30s
Correct.
usually? So is
Correct.
it like that they can take some precautions to uh, uh, before melasma happened or something like that? There are any treatments, or we can say any precautions somebody should really take?
Yes. So, as I said, women are more commonly involved. And if your mother or anybody in your family is having something like a melasma spots, you need to bring up your sunscreen level. Like we need to you look for those UV filters in your sunscreen, properly use the UV filters round the clock, where whenever based on your exposure, even a room full of lights or in front of the screen as a increased potency to increase the amount of you getting a melasma. So you need to up your sunscreen level, and probably take in more of vitamin C or antioxidants in your diet, so that the amount of cell death or the oxidation, the aging process is little delayed. Probably the amount of the earlier you get, the faster it could spread, so you can limit that process. So that you can do, including more and more of antioxidants in your diet, either as natural fruits or vegetables supplements, or as health supplements also. And increase your sunscreen level, will both as a chemical or application sunscreen, and as protective like umbrella, hats, those things also will help you with it.
Okay, so protecting yourself from UV rays by applying sunscreen and taking a good proper diet can definitely
Right.
help you in preventing melasma. Doctor, when we are talking about melasma, what are the different treatment options which are available for melasma?
Okay. The new things coming up and up and up, but the classical things comes stays the same. A very short course of certain creams, like with something called, we call it as triple combination, will help a lot. That is what most of the dermatologists start treating a melasma with a good strong sunscreen, both as a physical and a chemical sunscreen we usually use. And rather certain lightening creams that will lighten the amount of darkness that skin is having, like kojic acid, arbutin, vitamin C will help with the same. And a newer molecule called the tranexamic acid is out in the picture, like oral medicines is also there, and topical medication is also there. Certain when the patient is not responding well to any of these treatment, we do have lasers or chemical peels that will go a little deeper and exfoliate the skin and reduce the formation of these pigment, which will help in stubborn cases.
So that means there are various type of treatments which are available for melasma, and it can be definitely cured. It is not like that melasma cannot be cured.
Correct. It cannot see. There is no. We have people who have come out of that pigmentary stage. But only thing is, when you are also under pigment, when you're going on to a higher altitude, when you are getting exposed in a very excessively colder environment, you're stopping the sunscreen at all. Then the pigment that has already gone, waved you by and gone, can come back. So you need to be that protection is lifelong, whereas you do not have to like properly wait for the pigmentation if your sunscreen is actually strong, properly protecting it from coming back. But we have seen that particular pigment properly fading also.
Okay, so that means if you are having any symptoms or signs of melasma, go and refer a dermatologist because it can be cured, as doctor have mentioned. Doctor, there are some live viewers questions also. So the question here is melasma a hereditary condition, and should I be concerned about my family members developing it too?
Okay, so it has a strong genetic feeling with when your mother is having, or when any other female from your mother's side is having. You might, if you are a female born to a mother with melasma, you might have the chances of higher chances of developing melasma as you grow, as the hormones are hitting your pregnancy period. You might have. So all, you don't have to be scared. All you have to do is just protect yourself. Early you start. Nowadays we have seen mothers concerned about a child when they are getting into a pool, like concerned about starting them on a sunscreen. Not because your focus should not be about getting tanned. It should be on protecting your skin, because whether you're wearing a sunscreen or no, you're going to get tanned because of the melanin that is present underneath your skin. All you have to do is protect your skin from future skin issues that might happen. Tanning, you shouldn't be worried about. So even if you are thinking that you might get a particular condition like these melasma hereditarily, you just, all you have to do is just wear sunscreen, double up your fruits and vegetables, your antioxidant level in your diet. That's all. That's more than enough. And any small thing that is starting up, the faster you go, the better will be the treatment outcome.
Definitely. So as soon as you see some signs, you should start taking some precautions as well. Doctor, we have discussed about the various skin types also. There's a question from Ria asking: is melasma more common in certain skin types or ethnicities?
Yes, it's more common in a drier skin version of a people. Uh, Common. This is the commonest version of the thing. Um, Again, attributing to the amount of inflammation that can happen in a drier version of skin. So when we are talking about the sunscreen, moisturizer also plays a part. Not only in the dry skin, in a combination or the oily skin version, also there are separate moisturizers for certain skin. So properly pick up the moisturizer for your particular skin and use it. And definitely any other skin, it is more, even though it is more commoner in those types, then it's better to protect it properly.
Definitely. So protecting it is
The key.
precaution is the
Mhm.
key to
Yeah.
protecting melasma. If
Yes.
somebody is protecting themselves, usually, doctor, what people do is they are in a hurry. They don't apply sunscreen. They don't. But as you are saying that applying sunscreen is very important. So I think from today's whosoever is watching this live, I think they are getting a lesson that sunscreen application is very important if you want to
Correct.
protect your skin from melasma. Doctor, we have discussed about like self medication and the home remedies. There is a question from a viewer asking: should I avoid specific makeup products or skincare ingredients if I have melasma?
There's nothing to avoid as such, unless until you're allergic to it. Rather, if you are using a makeup product that is little tinted on that particular area where you have a melasma, it's going to be an extra protection. If you are choosing your sunscreen, there are many sunscreen. Sunscreen is not having a white cast sunscreen anymore. You want a fluid sunscreen, it is available. You want a tinted sunscreen, it is available. So better choose a tinted sunscreen for to putting on the melasma. That gives you a better protection when compared to a fluidy sunscreen. And you can use any other product when concerned to melasma. There is nothing that will trigger, but certain like those pains, right? Those skin pains. If you are a person who are using skin pains more often and often, and you are having a propensity to develop melasma, that might trigger, because so certain skin pains might have certain ingredients. For example, if like we have been seeing many makeup trends where they use lipstick as cheek blush, lipsticks as eyelashes also, right? There are certain formulation that has made us cheek and lip tint. That is different. The formulation in which is made is different. Whereas a lipstick, a proper lipstick that is made as a lipstick is different from a blush. And those ingredients that are made to make a lipstick might initiate an allergic response in the cheek, which might be the initial fire to the bigger flame.
Right. So using the product which is made for that particular thing is important, yeah, because it can definitely trigger melasma. Doctor, we have discussed about melasma, happening in girls and women due to many reasons. As men and boys can also get melasma. So, what are the causes of melasma? Because there is a question from our viewer whose name is Sachin asking that is melasma is permanent?
Okay. So actually, even though there is only 10% of the person, like are men with melasma, it's very stubborn. The word stubborn is used because with any initiation of treatment in a female, it usually reduces the good response. And but the melasma is little stubborn to treatment, but uh, probably when we treat it as a little stubborn variant of a melasma, then the treatment will be, it is not permanent. So only thing is, as I said before, it is never permanent. It can come under control, but the permanent remains on the particular person who's having it, because it's based on how much hormones are triggering it, how much UV exposure they are exposed to, the way and the amount, the what occupation they are going. If you're a person who is indoors, then even the stubborn melasma can respond very quickly. And for a male, only thing is, for a female, you might, if you see a patch that is circumscribed to only one particular area, in a male, it could be for a very bigger amount of area. So the treatment option also, if you're applying this particular cream to this area, for a male, you have to apply for the bigger area. The body surface area also matters, no? So the response is based on that. So even it is not permanent. The permanent depends on only a particular person. A good skincare, a good protection, a good advice from your dermatologist will lead you to a better care.
Right, and I think usually boys or men, they usually don't treat their skin. They find it that okay, this is just a patch; it will go away. But then when it does not go away, then they realize that this is something which should be treated properly.
Correct.
So, and as doctor already told, that melasma can be cured and it cannot be permanently if you treated it well. Uh, and if you have diagnosed it that this particular thing is need get attention and you go to a dermatologist, then it can definitely help you. So if you
Early.
have
Yeah.
early, right?
Yes.
So if you have any symptoms or signs of melasma, do refer to a dermatologist. And doctor, when we are talking about melasma, is it like that? Can melasma, if not treated well, and if it is not treated, can turn into cancer or any other serious condition?
Okay, nothing at sorts. No. No, this plain answer, no. Because we are talking about melanin. The reason, the reason why we are advising uh, a group of people like ours, like our ethnicity, to wear sunscreen is to prevent ourselves from getting a pigment disorder rather than a cancer, a skin cancer. No. So melasma doesn't, no.
Okay, so a strict no from doctor that melasma cannot cause cancer. Doctor, there are so many misleading information, or we can say misinformation about melasma and hyperpigmentation. And as we have discussed that hyperpigmentation is different and melasma is a part of information, do you want us to enlighten about the misinformation, which are usually, you have seen, that people can come to you and say that this is hyperpigmentation, but because they have searched it somewhere or somebody told them that ये मुझे भी, this particular thing have already occurred to me, and this might be this, so you should take this medicine which I have already taken. You have seen any such case, and what misinformation do you really want to clear here from here?
Okay, I'll have one important point there, but I'll address that little later. But one thing is, yes, first light was put by you, the skin malignancy. Is it a skin cancer, doctor? Should I be worried? Why is it keep on spreading it? And that has to be put light. It's a direct no need to be scared. Just protect your skin well, then that's gone. And one thing is, when they are addressing certain pigmentation, since I told the melasma is not only, so even though it's common in the face, it can occur anywhere on the skin, most importantly on this particular surface of the arms or the forearm. So what they'll think is any other pigmentation, or like any pharmacist who's dealing with these kind of people, like, well, like I have a pigmented skin in my face or anything, they'll start by giving you a steroid. So one thing with the steroid is it lightens the skin. Yes, it totally lightens the skin. But the thing is, if it is coming from a person with lesser information on the melasma, certain creams, certain when it is put for a very longer period of time, can damage the skin. You need, see, the thing is, you need a better collagen. See, collagen, elastic fibers, these things are, when we talk about aging, we concentrate nowadays on producing more and more collagen. Take this particular drink, you'll have more collagen underneath your skin. And even for the joints, collagen is essential. So when you're using long-term steroids that is given by a pharmacist or a person, a neighbor next to you, but after using, because obviously, as I told, the glow is actually real, and all they wanted is that particular glow, because just to feel better about themselves from this particular pigmentation, is to hide that pigmentation and then glow rather. So when it is used for a very longer period of time, the collagen is going to come down, the aging process is going to start early itself, and most importantly, the skin is, which is supposed to be this much thick, will get thinner like a thin piece of paper. So the elastic, the way it's going to stretch, like how it's supposed to be stretched, is going to get lost. So it's going to get even more wrinklier, even more exposed to the sun exposure. So do not follow that. And the most important light I want to throw here is the medicines that are used for melasma itself. On other, like usually we give a particular cream for a very short period of time and stop it, and then give alternates to it. The reason is to maintain this effect and to reduce the side effects that could possibly arise because of certain agents. So, on the neighbor or anybody who has already undergone these treatment, ask them to continue for a very longer period of time so that they have a better skin. In overusage, we actually have some complication called uchronosis, where even here, the person who was asked, right, it is permanent. When the person keeps on using certain ingredients that are not supposed to be used for a very longer period of time, they have permanent pigmentation that could develop underneath the skin. That will not go away with any other treatment modalities that we are aiming at. That could be permanent. That uchronosis can be permanent. So we have to be very, very aware. Like if it is not going, you keep on rubbing the cream, that thing is not going to go away. Even more, it's going to go bigger and bigger. So you need to differentiate. Obviously, you cannot do it at home. So that's why we use, it is, Dermascope gives you those things.
Right. And that's why consulting a dermatologist is the most important thing.
Yes.
Because whenever we see any patch or something, we scratch it or thought that, this might go or what it is happening. And I think that is also important that if you see something, go refer to a dermatologist, as doctor said, because some marks can be permanent if they are not treated well. So it should definitely go to a dermatologist. Doctor, there is a question from a viewer asking what precautions should be taken for melasma?
Okay. So by now, the entire life is focused on sun exposure. So one, yes, sunscreen. Sunscreen, applying the sunscreen, either chemical sunscreen or the physical sunscreen. Physical sunscreen, physical filters like zinc oxide. Your sunscreen should have certain physical protection as well, like zinc oxide, titanium dioxide, and certain other chemical filters as well. And there are certain, if you're going on a holiday, you can take when you're expecting excessive, like if you're going to Goa or any other Pondicherry or anything where your exposure to the sun exposure is going to be huge, then you can intake certain oral sunscreens also. There are humpty number of oral sunscreens that are available in the market also. And there are sunscreens specifically for the body. Most importantly, when you are going to an area where your dress is going to be like something like a bikini or very lesser clothing, you need to have those wide brimmed hats, which is very, very wide, like usually how the female in the beach, they post those kind of bigger brimmed hat. Sunglasses. Then there are certain arm filters, UV arm filters, available in online or any other sport outlet that you visit. And the most heavy protection clothing can offer is from a denim jacket. So you go on a bike, you wear a denim jacket, you're sorted out. So these are the protection, physical protection, and those sunscreen protection that you need to be very, very aware of. Even for people who sit inside the car think that, okay, they're protected by the AC, they're protected by the shield. No, they're not. It can pass. The UV index can pass through and go into your cheeks. And AC actually aggravates the dryness in the skin. So it's going to be even more worse. So it's not the other way around. It's the actual other way around.
Yes, and applying sunscreen is must. Whether you are going out or whether you are in the car, it is important that you apply sunscreen. One question which is in my head, that is melasma can occur due to some allergy or infection, or is it like a total different thing?
No, it's not an allergy or an infection. It probably an allergy in the skin could be a spark to the bigger flame, but it's not the allergy or an infection that is triggering melasma at all. No, this is not something to do with an acute episode at all. This is something that is already predetermined.
So it is not due to some allergy infection. It is not also an allergy infection. Doctor, any advice you would like to give to all the viewers watching this video?
Yeah. First thing would be is see, not all melasma is melasma that you think. Whatever that you think as melasma is definitely not only melasma. It could be anything. So because whatever that we see in our eyes, it's not going to be the same when we look through the glasses. Even as dermatologists, we use a particular device in our clinical practice to go deeper into the skin to exactly know what it is. So not everything that you think as melasma should always be melasma. So keep that in mind. Do not follow random DIYs or random pharmacy grade products, or even certain ingredients that have worked for others. And because each and every, even melasma occurring in a skin of many, many people is not the same in each and every individual. Thirdly, sun protection is the main. You protect your skin, you are sorted. So, yeah.
Yes, very good advices you have given to all the viewers watching this live. Before we end this very informative live session, any takeaway message for all the viewers?
Okay. So, one takeaway is Always take your sunscreen. Second, like let it be anything. You don't have to. One main takeaway is you don't have to look on the SPF level. You don't have to look for is it should be 100 to protect the melasma. It should be 50 or 30. Let it be anything. Just take it away with you.
Yes. So sunscreen, keep sunscreen in. Take away messages. Take sunscreen with you. It is very important, and apply it. From time to
Yeah,
time.
obviously.
That is very important, and I think all our viewers today are taking this takeaway message that they have to apply sunscreen in any case they are moving out or they are in the car or they are exposing to the UV rays of the sun. It is important to apply sunscreen as it protects melasma, and if you see any signs or symptoms of melasma too, go to a dermatologist. And thank you so much, Dr. Radha, for your valuable time. And
Thank you so much. Thank you so much for having me. Thank you so much, beautiful Spotless Skin, for having me in this live, for giving me this opportunity. And thank you, Arka. Thank you so much.
thank you so much. And it has been a very informative session for our viewers, and it is great to hear you.
Thank you. Thank you. Thank you. Thank you. My pleasure. Thank you.
And we really look forward for many such sessions for our viewers in the coming time.
Yes. 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 Yes, ma'am. Yes, madam.
Thank you. Thank you so much,
Thank
Doctor.
you.
Thank you. And thank you so much to all the viewers for your excellent participation in today's session, and stay connected to our beautiful Spotless Skin page. Good day to all.